The Black Boston COVID-19 Coalition has been shifting its focus recently to reducing racial disparities in access to vaccinations. There has been progress, but also some problems reported at local pharmacies, including one at Grove Hall, with complaints about a lack of distancing. To help bring us up to date and apply some perspective is a member of the coalition, Dianne Wilkerson. Thank you very much for being with us, Senator.
Always a pleasure, Chris.
So I want to start with the state of public attitudes, the communities that you are working with right now. Before, we were told to expect there would be more reluctance to get vaccinated, but what have you found since then?
Well, what we found is that we shifted our complete total focus from focusing on people who were hesitant or distrustful to focus on people who wanted access. Because what we are learning is that even the people who have some distrust, when they see people that they know get it, like I said to people, look, my arm didn't fall off, right? When they see people that they know access and the process is one that they can that they can work through, we're overwhelmed. I mean, I think it's wonderful what's happening, and it's not just, don't just take my word for it. You know, a month ago, Massachusetts was number 42 in the country in terms of Black vaccinations. In 1 month, we've moved up to number 2 in the country. And it has all to do with what's happening on the ground in Roxbury, Dorchester, Mattapan. We could pat ourselves on the back because clearly the Reggie Lewis tract is a mass vaccine site. And so they've got the volume and the numbers, and we are seeing an enormous response to people. They just want somebody to tell them how to do it. And then we've got a number of community sites as well. We've got pharmacies that are doing the vaccine. And what we're finding is people are taking advantage of it.
What about your own attitude to getting the vaccine?
I was one of those people. That was like, I don't know enough about it. Not too soon. I know that no one could tell me history because there is no history. I mean, Christ, a year ago in March, we didn't even know what coronavirus was. And so I was hesitant. And what I finally had to deal with is the reality of not wanting to put anyone in my family, my friends at risk. Wanted to see my mom. My mom lives in an assisted living facility, not even 10 minutes away from me. She's up in Mission Hill. And we haven't seen her, like physically been in a room with her in a year. And so we're all, I just got my second shot. I have family members who are getting their second. And we're going to have her 85th birthday party finally at the end of this month that she missed in July. I have a granddaughter who's graduating from Howard University in DC, and they had announced virtual exercise. But they said, depends on how things go, it could become in person. And so I just decided I had to get ready. I have a granddaughter graduating from Newton, and there's no way I could imagine not being there for it. So sure enough, Howard announced over Easter weekend that they in fact are having in-person graduation ceremony. So I'm going to be in DC for Mother's Day weekend. But it's a personal, the whole point is, Chris, it's a personal decision people have to make. It's not something that I don't twist arm to people. I tell them, you got to figure out your why. You want to be in a situation where you're not harmful to anyone, or that you not allow people to be harmful to you, because the numbers are steady increasing. We are racing, trying to stay 2 steps ahead of the virulent. Yesterday, we get an announcement. There's a whole new virulent now from India. We already had South Africa, Brazil, UK, and the US, and now we add India to the mix. And so we just have to stay on top of this. I want to have a summer. I'd love to see Boston have some semblance of a summer, but it's going to take the cooperation of a lot of people for us to do that. And I think we're on our way.
When I talk to people who've been to the mass vaccination sites, the impressions are that it was efficient, it was well regulated, it was courteous. But there were other sites where you're concerned about the conditions and the way things are being handled. What's going on? What do you see?
I will say this week is the first time that this has become a public discussion, but we have been discussing it. And that is the whole notion of the utilization of pharmacies, local pharmacies in our community, as vaccine sites. And so we had a very crazy moment this past weekend at the CVS pharmacy and the Grove Hall Mall. And so much so that one of the Black Boston COVID-19 Coalition members literally went over to the place to see it in person and was able to take some photos. Very concerning. One, the place was filthy, like trash all over the floor. And the second is that there didn't seem to be any notion or concern about social distancing. People were standing in line within like 1 feet of each other. And anyone who's been to to one of these mass sites that you talk about, or even a community site, they're just they're obsessed with it, and I appreciate it. You have to do the 6 foot distancing. You have to sit and be observed for 15 minutes after you get the vaccination. And if you reported an allergy, you have to sit for 30 minutes. We're watching people get the vaccine shots and walk out the door. We have pictures of long lines there, people on top of each other. And it makes you wonder for the first time, it's like, wait a minute, who's monitoring the pharmacies? Because we don't want our pharmacies and our communities to turn out to be the super spreaders. And that vision that we saw last weekend at CVS looked like the potential for just that, and it's got to be dealt with.
CVS says they didn't hear any complaints about this, and they did send us some photos of the same pharmacy in Grove Hall. Maybe when there weren't as many people around, it looks as if they have markers on the floor and so on. So what's the missing piece here?
Well, no one's ever said they don't have markers on the floor. You saw that photo. It's clear that no one's monitoring that. There does not seem to be a place or a process to be monitoring people once they've gotten the vaccine. And if it's required at the mass vaccine sites, it must be required at the pharmacies. Because last week, if you recall, the president announced they're going to triple and quadruple the number of vaccine doses at pharmacies because Washington thinks that's an efficient way. It might be efficient, but it's not safe. It is not safe. We expect the facilities to be clean. They have a company on site at the mass vaccine site at the Reggie Lewis, who's, as soon as you move out of a chair, somebody runs and wipes your chair. They're wiping them down. They're sterilizing them, because that is the level of care that you have to create the kind of safety and the cleanliness in a process where you have a virus, a live virus. And so we don't see that. And we don't see it. And somebody's got to be on top of it. We did call inspectional services, the city of Boston, and I know they were going over yesterday. They've been there already. We're looking to get a feedback today from them about what happened, but this can't be how this works. It can't be.
Well, compared to the Lewis Center or Gillette Stadium, for that matter, what was in your pictures from the coalition, it does look shabby. Why is shabby such a big problem when you're talking about the mindset of people who need to get vaccinated to stop the spread?
Well, first, shabby is in this instance is equaling unsafe. That's the biggest issue. And the reason when you see people in that line, Chris, those are people who've decided, despite all of that they're hearing, people in their ear questioning the long-term effects, they've decided, notwithstanding that, I'm going to get in that line because I want to get the vaccine. And so many of them are nervous right up until the time that needle goes into the arm. To look around and see people on top of you when you're nervous, and you know that social distancing or physical distancing is a real thing. You know that the cleanliness, because you're home, you're wiping, you're spraying, to walk into a pharmacy and see trash strewn all on the floor in the middle of the day, the trash basket teeming and overflowing, that can't be accepted. It's just unacceptable.
I want to ask you about the way Boston is doing right now with vaccinations and the racial disparities. They were worse before, but it looks as if the numbers for the Black community, and maybe even more so for the Latinx community, they're not where they should be.
Of course not, because we're dealing with the reality of decades, I say, of poor relationship with the communities of color, Black and Latino in particular, and healthcare institutions. And so we're dealing with that. The fact that we have been able to move the kind of numbers that we've seen, I think, is pretty commendable and probably nothing short of a miracle, because where we started, because you've been at this for a long time. You know this history as well as I do. That that's the kind of the ghost that we're dealing with. And so we have to convince people that despite that, I will say this too, Chris, the reality is that the majority of the people we talk to, They don't know where Tuskegee is and don't know what syphilis is. What they're thinking about is the relationship that they had last year. They're thinking about watching the governor, every day at his COVID-19 briefings in January, talk about how the vaccine is coming. We have to prioritize the Black and Latino community because they are the most vulnerable. We have to make sure that they're first in line. And then he announces that he's going to cite the first center at Gillette Stadium. We were going like, hey, Governor Baker, we're over here. We don't live in Foxborough. That's the kind of thing that people are talking about to each other on the text, on the Zoom calls. Well, wait a minute. I thought he said that we were priority. And why would they put the center in Gillette? That's not where we are. And so I think people just have to be more mindful that the decisions and the messaging have to be consistent with your actions.
Finally, Senator, if people who live right here in Boston need some help getting access, setting up an appointment, is there some way they can get in touch with the coalition?
Oh, absolutely. We have both a bit.ly link, we have a phone number, we have a website, any number of ways. You can go on the blackbostoncoalition.org. That's the website. You'll see on the front page, the link, bit.ly, it's bit.ly/Black Action. You can go through that process. You can also call. We have a 617-636-750-0005 number. People can call. What we've done is turn the whole state process on its head, where the state process relies on people being able to maneuver internet and call and get through to them. We call people. So we have people on the ground. There's an outreach team out every day where they're doing door knockers. We have all of our materials is in 9 languages. Last week, we were in Chinatown. 2 weeks before that, we were in the Vietnamese community in Dorchester. We were working with the Latino elected officials last week. And I'll tell you, Councilor Judy Mejia has done something so incredible. She created a Google Doc. As of this morning, she has almost 1,500 people, mostly Latino, who signed up to get a vaccine in 1 week. That's how we're making a difference.
Well, thank you very much for taking the time to join us. I know you sound very busy.
Yeah, we are. But thank you for always having time to create the space to share important news to people. Thank you, Chris.
Great. Thank you very much. That's Dianne Wilkerson from the Black Boston COVID-19 Coalition. We'll have more news in just a moment.